I think no one has joined except one person, but then well, we can definitely move ahead as per our schedule. So let me start with the totally three things we are going to manage today. And the one is about probability, other is about the scatter diagram, correlation coefficient, regression equation, and third is we'll be talking about the randomized control trial. So, and then afterward, if you want to go for analysis or etc., if info that we can go ahead. So, let me share the screen. Now, in this case, the in scatter plot, we are going to go about the plotting of two variables, quantitative variables like height and weight, income and expenditure, or blood pressure versus serum creatinine level, or cholesterol level and the uh, creatine level, something like that, that we are going to do it. If the dots cluster around a straight line, it shows evidence of a relationship of a linear nature. And if there is a no such cluster, it means that there is no relationship between the variables. If there is a linear line, then let's naturally it says that there is no relationship irrespective of one variable, other variable remains the same. But in this case, for example, the we can see the dots. If you make a lines between the dots, it is a straight line showing that as one thing investment committee increases, savings in medical care will be there. I will give one example. If we give a good training, let's say in our Kutch, when we train the people for 1 year, and when they worked in their community, 50% expense was reduced. That means if you go on increasing the input on the training of the people, automatically the expenses on the medical care will be less. That or reverse way, savings in the medical care will be more. So in correlation, whether two variables are interdependent or co-vary, that is estimate the degree to which they vary together. If one increases, the other also increases. In order to find out whether there is a significant association or not between two variables, we calculate coefficient of variation that's known as R, right? If and the formula for R is, you can see that the variation between X and then variation between the Y. And this variation is from the mean, right? And it is divided by the summation of the variations, right? Now, if R is equal to 1, right, that is a absolute correlation. And if is a R is equal to 0, no correlation. So it can be -1 also. That is inversely correlating. If one increases, other decreases proportionately. If it is near +1, there is a positive association. If it is near -1, it is negative association. And 0 indicates almost no association. In advanced statistics, even this value of R is also significant or not. That kind of calculation is also possible. So this is about the correlation coefficient. And this correlation coefficient is given in AP info by there is a command. We can use that command linear regression. Linear regression and then two variables that will show uh, the R value, correlation coefficient. The next which we would like to see is probability presentation. So when we talk about p-value is nothing but a probability of event occurring by chance. And when we talk about event occurring by chance, At that time, we need to understand probability. If I say what is the probability of rain today, I may say 20%. I mean, that means probability of not raining is 80%. So if you make a total of raining today plus not raining today will be 100%. So if I say that the probability that rain will fall today or probability that rain will not fall today will be 100%. But if I use that probability that rain will fall today and rain will not fall today, if you combine these two, then it will be zero. So when we use the word and or, it is very, very important. Right? And whether the events are mutually inclusive or not, that is also important. If one variable is there, other will not be there, or there can be two together also. Suppose if you have two coins, and then if you do king and cross, and this is king and that is also king, that is independent. This could be king and the other could be cross also. So in this case, when you say that both will be king, what is the probability? Then probability will there will be a the and you are using and that's why there will be multiplication. But when if you say the or, then there will be the total of it. So this kind of law in the probability will be seen. And if you understand this probability carefully, then the p-value will be easier to understand. And at the end of research, when we do the data analysis, this probability is very important. So probability may be defined as the relative frequency or probable chances of occurrence with which an event is expected to occur on an average. So when we say that the event might have occurred by chance, that is what is the probability that it has occurred by chance. That is how we are calculating p-value. And when we use the word p in statistics, P is the probability of event occurring by chance. P is the probability of event occurring by chance that we are finding out. And one of the examples giving birth to a boy in the first pregnancy. What will be the probability that the first child will be the boy? Chances of one drug being better than the other, right? So one drug A is given this much result and drug B is giving this much result. For example, azithromycin is giving this result, right? And the amoxicillin is giving this much result. Which one is better? What are the chances? Like that. In other words, it denotes the relative frequency or odds with which an event is expected to occur on an average or in a long run. So, out of say in case of a simple example, if in a box there are 5 green balls and 95 red balls, if you close your eye and randomly find out one ball, what is the likelihood? It will be 5 out of 100, it will be the green, and 95 out of the 100, it will be the red. But when you say that whether it will be the red or green, if you pick up two balls, for example, huh, and then if you say the first ball is red and second ball is green, something like that. If you want to have this kind of probability, this can also you can calculate if you understand the law of probability. So probability is usually expressed by the symbol P and it ranges from 0 to 1. It is easier to understand P provided you understand that unity. Probability is always out of unity, and 1 is a unit. When you say the percentage, cent is 100, percent per 100. Similarly, probability is always by default is out of 1. So, when we say that P is 0, is 0%. But when say P is 1, P is equal to 1, that means E is equal to 100%, right? So, if the probability of an event happening in a sample is P and that of not happening denoted by Q, then P is equal to 1 minus P or P plus Q is equal to 1. So, probability of event occurring by chance is 20%, Q is 80%. But usually we write P is 0.2 and Q is 0.8. One can estimate probability by logic alone. For example, the probability of drawing any one of the four S's from a pack of 52 card is 4 out of 52. If you randomly pick up, if there are four S's, then out of 52 cards, 4 out of 52, that means 1 out of 13, that will be the probability of it will be ash of any color. And not will be 12 upon 13. By 12 upon 13, you will not do it. So Q is equal to 12 upon 30, P is 1 upon 13. Simple looking probability is absolutely important. Arithmetically, we calculate the probability or chances of occurrence of a positive event by the formula P is equal to number of events occurring divided by total number of trials. If a surgeon transplants kidney in 200 cases and succeeds in 80 cases, then probability of survival after operation is number of survivals after operation is 80 out of total 200. So it is zero point 0.4. In terms of percent, we say 40%, but probability is zero point 0.4 and probability of dying is zero point 0.6, 60% you can say. This is how we calculate the probability. This similarly looking thing, when it comes to about 5 year survival rate, 10 year survival rate, when you want to prepare a life table, at that time, the probability is very important. See, when you say that what is the lifespan of the human race on Earth, you need to take control of all the 80, 800 crore population, right? If you want to look into India, 140 crore. If you want to in Gujarat, then you 7.5 crore population, you need to consider for estimating a lifespan of an individual, like expectancy. But because of there is a lot of death in the first year, so sometimes life expectancy we consider at the age of 1 year. So, similarly, you can calculate if you understand the life table, how to do it, then it is easier not only for human being, for the instruments, for the equipments, etc. Also, there could be a life table. These are the laws of probability, and they are very simple. Need to understand only once, and there is a chances that based on this law of probability, you will be able to evaluate your patient outcome, the choice of the medicine, or choice of anesthetic agent, or the counseling method, or strategy which you should be applying at the community level. All this will be helpful if you know the laws of probability. One is the addition law of probability. There is another is multiplication law of probability, then binomial law of probability, probability from a shape of a normal distribution or normal curve, and probability calculated values from the table. Uh, is a Z table, it could be a chi-square table, it could be the F table, etc. Now, here we need to understand that the probability addition, multiply, etc. When you are combining two medicines, for example, you want to combine two antibiotics. First 5 days you are giving azithromycin, next 5 days you are giving vancomycin, for example, etc. Then the probability that the bacteria will survive, and then the probability that after giving next, also the bacteria will survive. So which one should be given initially, which one should be given after, or will there be any difference or not? Such calculation can also be possible. Now, addition law of probability. If one excludes the probability of occurrence of the other specified event or events, the events are called mutually exclusive. If they are not related to each other, right? So it's a mutually exclusive. Getting heads excludes the probability of getting tails in tossing a coin. So when you toss a coin, naturally either it will be head or it will be tail. They are mutually exclusive events. Birth of a male child excludes the birth of a female child. Any event will occur in one or several ways. They all have an individual probability or relative frequency of occurrence. total probability will be equal to the sum of the individual probabilities provided the events are mutually exclusive. So these are the addition law of probability. Thus, mutually exclusive events follow the addition law of probability. If number of mutually exclusive events are n and pi is the individual probability, then total probability p is calculated as pi means p1, p2, p3 like that up to n, right? The word or is there when addition law is applied, as we are getting Rh negative or Rh positive child. A drug will cure or relieve or have no effect on the disease. So if you say that what will the probability that it will be either cross or king, then it will be 100%, right? 50% king, 50% the cross, uh, that way. Or suppose there are four outcomes of the patients. One is cured, other is died, third one is worsened, and fourth one is absconded. Do not know about it. So out of 100 patients, if you consider what is the result, based on that, we can call the probability, talk about the probability. And when you say the patient cured or absconded, what is the total? In that case, when because it's the word or, you can make a total of it. Now, when say the multiplication law, this law is applied to two or more events occurring together, but they must not be associated, must be independent of each other. Suppose here is a we are talking about the birth of a child, and other side you are talking about king or cross. Both are not associated. And when you say that, what will the probability that there will be boy child and probability of there is a king, like this. So in such cases, you need to use the word and because you are going to use the word and, it will be a multiplication of the law, right? In this example, the when you are throwing the dice, 2 and 5 or 5 and 2 in the two throw of dice. So example where multiplication law cannot be applied. Out of 100%, 10 smoke heavily. Remember, this is very important. And probability of getting cancer in heavy smoker is 1 into 100. Out of 100%, 10 smokes heavily. And probability of getting cancer in heavy smokers is 1 into 100. So what are the chances of being a heavy smoker and getting lung cancer? Then what you do, 10 upon 100 multiply by 1 upon 100. Because you are using the word n, then 1 out of 10,000. But this is not correct because here the law of multiplication cannot be applied because smoking and lung cancer are associated. That's why you cannot use this n, right? Otherwise, it will be a wrong interpretation. Then binomial law probability. This is formed by the terms of an expansion of the binomial expression p plus q raised to n. So it is raised to 2, raised to 3, raised to 4 like this, right? N is equal to sample size or number of events selected at random for whom the probability is to be worked out. P is the probability of success, Q is the probability of failure. So P plus Q is equal to success plus failure is equal to 1. Now, when you do it, see, this is a very good example which you will be knowing the binomial law. Very, very good example and is practically possible to calculate. Instead of children, you can take the patients also. In 4 ICDS projects, 20% of children are under 6 years of age were found to be severely malnourished, grade 3 and 4. In 4 projects, 20% malnourished. If only 4 children were selected at random from the 4 projects, what is the probability of 4, 3, 2, 1, and 0 being severely malnourished? Now, in this case, n is equal to 4, right? Because we have selected 4 children. And the 20% of children are malnourished, grade 3 and 4, and the 80% are rest of the children, that is normal and grade 1, 2. Now the question is, what is the probability that all the four will be malnourished, only one will be malnourished, or zero will be malnourished? What is the probability out of this four children? So here look at the things. P is equal to zero point 0.2, Q is equal to zero point 0.8, and N is equal to 4. Now, as per the terms of expansion of binomial expression, this or that, right? Four times we are doing. So P plus Q raised to 4. If you look at the separate the equation, it is a P4, 4P3Q like this. Now, substituting P and Q values in the equation, the final result is as follows. Probability of all four being severely malnourished is 0.16%. So when p value, when you put a zero point 0.2 over here, and then you make a 4, then it is zero point 0.2 into zero point 0.2 into zero point 0.2 into zero point 0.2, right? So it will be 0.16%. So this is how the probability will work out, right? Because here it is written that P4 means all the four are should be that. That means the all four matlab P1 and P2 and P3 and P4. So you then multiply all these four, P into P into P into 4. Then you will get this result. Similarly, if you solve the equation, you will get rest of the probability also. Now, probability of calculated values occurring by chance in case of T and chi-square table is determined referring to the respective tables. When I say the Z table, chi-square table, T table, at that time in each table, there is a specifically calculated values are there. And you need to compare table value versus calculated values. And see, when you compare the table value and calculated value, you know the probability of occurring event by chance. So I think I will be showing the tables on the screen next time. Chi-square table, Z table, T table, etc. Once you understand how to read the table, you'll be able to calculate the probability, and based on that also you can find out the numbers. And for example, you are supposed to find out, let's say, out of 1,000 patients, how many patients will be earning more than certain amount? How many patients will have to stay more than 10 days? How many patients will have to stay between 5 to 7 days? All this calculation we can do, provided you know how to read the Z table. So here we end the probability. If you have any question, we'll address to that. Otherwise, we'll be talking about the randomized control trial so that we can utilize in our day-to-day life. So if you have any are you having any question? Otherwise, I'll be going for the randomized control trial. So any question? So let us go to RCT, randomized control trial. Huh? When we talk about randomized control trial, it is essential to start with some examples why we need randomized control trial, and then we'll be moving further. So we go with the simple examples that let's say we have aspirin tablet as a painkiller versus paracetamol and versus placebo. Now in this case, Let's say that we are having 300 patients and all suffering from mild headache, all from mild headache. Let's say like this. And we want to see the efficacy of the three medicines, placebo, paracetamol, and aspirin. So, these 300 individuals who are ready to undergo experiment patients, we randomize into three groups. And randomization is done by, let's say, you are allocating number to each one, two, three, four, like this. And you are given number up to 300. And then, because these are all the number together, and then we choose a series 1, 4, 7, like this is the group 1. Then second group 2, 5, 8 is the second group. Call it a B group. And third group 3, 6, 9. Let's see, this is the third group. And all these three groups, one subject to aspirin, other to paracetamol, and another group subject to placebo. And then we can definitely uh, evaluate this three together after let's say 10 days, 15 days, or daily, or even hourly. You follow these three groups for the purpose of the result what you get. Improved, not improved, like this. So the word randomization, why we are using, so let's go back to our case control study. In case control study, we have the selected cases first, and based on each case, we have selected controls, and then retrospectively, we are asking history that you are exposed to a particular thing or not. In core study, we are taking like this: those who are exposed and not exposed, we follow them up. That is a core study. But when they are exposed in core study, already there could be other existing factors. For example, if you are taking that whether the person is taking, let's say, non-vegetarian food or not, and versus vegetarian food. Along with non-vegetarian food, there may be a religious may be added to that. So that may be a compounding variable. If you take another example, for example, see the people waking up early in the morning versus late in the morning, and you want to compare their health, what will happen? Well, those who wake up early in the morning, they might be doing some other things, pranayam, yoga, etc., etc. So it's not exclusively the early waking up might be giving them health. There could be other things also. So in cohort study, also there could be intermingle other factors. In randomized control trial, what we are doing, we are removing other factors. Suppose if you want to see the effect of early waking up, what can be done? You select the volunteers, right? See 1,000 volunteers and select that. Out of that, those who are early waking up, late waking up into two groups. Then early waking up, you say that are you volunteer? If you, I tell you, all of you that you may be in any group, waking up early or not, you should be ready to follow. Are you ready? Say yes, we are ready. Those who are ready, we divide into two groups. Purposefully, we ask half of the group in the early wake up and late wake up. In also late wake up, in that also we do the same thing. Early wake up, late wake up. But that is a randomization should be done in both the groups. So we have now four groups. We follow them up and then we look at the outcome, whether it is purely the effect of early waking up or not, that we'll able to know. So in randomized control trial, we are controlling the things, we are randomizedly making a groups so that the rest of the factors are automatically taken care. There is no least likely that there is a confounding variable. So in this randomized control trial, we can calculate the relative risk, we can calculate attributable risk, we can calculate the effectivity, attributable risk, everything we can calculate. And instead, in when we use the word the associated factor or causative factor, the word risk is used. But when we are using the medicines, etc., then what will the contribution of the medicine in result? That word is not the word risk, right? It's the effectivity, how far it is more effective. That word we should be using. So now, in a randomized control trial, the first thing what you do, you choose your topic, then you choose your population where you are going to work, then you draw your sample, and then in the sample, you divide into groups. Sample you divide into groups randomly. That is most important. Randomly. And then two groups, three groups, four groups, as per your the study design, use at least two groups are there, right? One is the study group, other is control group. And then you follow them up for a certain period of time. And then once the result is there, you do the analysis. This is how we are doing randomized control trial. It's very easy. Now, you will be able to learn much better, provided you take up your an example. Suppose you are supposed to do some kind of randomized control trial. So, which topic you will take? Let us discuss that. So, only two of you are there, but doesn't matter whether one person, two-person, at least someone more than me. So, Dr. Sonali Mishra, can you talk about your designation or subject of interest? What are you doing right now? Dr. Sonali, are you listening? Okay. Yeah.
Hello.
Can you tell me what your designation or what are you doing right now?
Sir, I'm a dentist basically, and I am doing actually Master of Public Health and Management in Public Health from DHB University, IMS in Indore. So, sir,
Well,
actually, yes, sir, I'm keenly interested in research methodology, and my area of interest is NCDs, sir, non-communicable diseases.
okay. Now, but because you are dentist, we will not leave you without dentistry. Let's talk something about the diabetic controls, control of
Yes, sir.
diabetic patients in patient having the teeth problem and no teeth problem. Something or the dental problems treated, dental problem not treated. So
Yes,
now
sir.
let's see, let us take an example. We have, let's say, 500 diabetic patients. Out of 500 diabetes patients, we have, let's say, 50 patients who are having some problem about the dental problems, right?
Yes, sir.
Out of 50 patients of diabetes, we randomize into two groups. All the 50 are having dental problems, remember. So randomize into 20-25 groups. One group is subject to dental treatment, other group we leave alone. We don't take any. Rest of things goes on as already which is going on. So what will happen? The you are randomly randomizing two groups, right?
Yes, sir.
And patients are initially taken consent that you may be coming in any group, but if you come into certain group, we'll be giving you treatment of your dental problems. And if
Yes,
your
sir.
another group will not give you the treatment of dental problem for 2 months or 3 months, you say them in beginning. And
Yes.
then, if you treat these 25 dental problems, probably what will happen that they'll be able to chew properly. Because they're
Yes.
chewing properly, they'll be able to take fruits and vegetables. And because they can
Yes.
do that, probably their diabetic control may be much better. And
Yes.
you follow them up for a weekly follow-up like this, right? So this is how we can do the randomized control trial. Or you have, let's say, nowadays people are talking a lot about reversible diabetes. Initially, when we were young, we were told that diabetes is a lifelong thing. Now, allopathy also accepts, yeah, it could be reversible. Let's say out of the same 500 diabetes patient, we ask them question, would you like to go for reversible, yes or no? And then let's say 100 says yes, we would like to undergo. Out of that 100, again, randomized to two groups. One group, we go stand for the counseling for the reversible. Other 50 won't do, we won't do it. And then follow up for 6 months or 1 year and see result in both the groups. So like this randomized control trial can be done.
Yes, sir.
And the data analysis, if you're a smaller sample, you go for non-parametric test. If you're larger sample, then you can go for the F test, T test like this, Z
Okay,
test,
sir.
etc.
जी sir.
So while the Panu, I can't spell out the name of this other person.
Yes.
Can you spell out your name? Yeah, other participant, can you spell out your name other than Sonali Ben? Yeah.
Panuganti, sir.
Panu?
Panuganti,
Anuganti. Yeah, can you tell me? I forgot your physician or
physician, physician,
what is your designation, specialty?
MD General Medicine, sir.
Huh?
General Medicine,
I can't get
MD Gen-
you. Please spell out loudly, or you can write down in the chat your specialty, please. I can't get you, so that we can take an example as per your specialty.
MD General Medicine,
General medicine. Okay. So in general medicine, we want to go for randomized trial, and let's say you want to the and one is amlodipine you are using. There are two groups of hypertensive patients. One is amlodipine, other either you can choose a medicine or you can say dietary control plus, and we are talking about a mild hypertension, so it is not ethical a problem. Control plus exercise plus other lifestyle, right? And then you have around, let's say, 200 patients of mild hypertension. They agree to undergo the randomized control trial. And you start a low dose of amlodipine 2.5 milligram one group. Another group, you go for integrated lifestyle advice. And then you follow them up on a weekly basis. And after 6 months, you will see the results between the two groups. That is a randomized control trial, or you can use between the two drugs, or there can be one drug, second drug, and the lifestyle modification, all drugs plus lifestyle modification. In other case, only drugs. This can also happen. And while we are talking about this data analysis, usually we talk about the quantitative data analysis. But remember, there's something like qualitative research also. What happens that if you do only the quantitative research, you will not be able to the have a clear picture always. Because some of the patient or a person, when you go into the detailed history, there can be so many interaction of social factors, economic factors, or religious factors, cultural factors. So many things are intermingled. So when you go into detailed history, 1 hour, 2 hours, and repeatedly when you go for the some link, you may be able to find out, and that may be the your one of the research that uh, you can bring out. Suppose you make a focus group discussion. One of the research method, qualitative research method, is the focus group discussion. You have a focus that you will be talking on this topic, your group of people, and you are collecting the data. This is recorded in the cassette with their permission, and this you will do the analysis later on. Okay, who was telling what? Then individual detailed history taking, that is also very important. And sometimes the by while just by asking the questions, sometimes you are doing educating the patient. You are generating awareness because such questions were never asked to them. So sometimes asking the question itself becomes the educative for the patients. So in qualitative research, then you need to do the analysis. People are what types of food people are eating, what kind of habits, what are their beliefs, and if you know these things, then the strategy to improve their life may be helpful. So in a qualitative research also, and usually when we say the quantitative, we have 100 or 200 data like this. But in qualitative research, usually you have a 10 patients or 20 patients like that when you go into detail, and then you do the framework analysis. In framework analysis, you have certain topics, headings, and for each case, you put the keywords in that, and that type of analysis you are doing in qualitative research. So the combination of qualitative and quantitative research will be much useful. Now, if you have any question, will be addressed to that question. Otherwise, the data sent by one of you will be analyzed in AP Info. That's what we are going to do. Anything else you would like me to address? Shall we start a data analysis otherwise of the file sent to me? So Excel file Dr. Panuganti has sent. Shall I do the analysis of that? So let me open that file and you will see the procedure. So this is a file which you sent to me. You can see the file, right? Now, before we do the analysis, we'll copy that file. So not doing change in the original file. No, enable editing. So here, look, this file is sent to me. The problem is total 251 records are there, right? But in that, the first is the headers. So header, it is given in a different way. So first thing what we will do it, we'll make it. So once you have made it horizontal, all these headings ideally should be in a short form, right? Rather than the big things. But we'll not spend too much time on that. But then let us at least we remove all the filters. We remove all the filters. So now this file has become simple file. This is headings. Looks like the good Excel file. Now, as I told you, you should be preparing a matrix. Which two variables you would like to compare? So we have around 26 variables out of the important variables to consider, and which two you would like to compare, that you should be selecting. So we will have age as the continuous variable. Now this is the age group. Remember, whenever is possible, you avoid grouping the data unless it is required, because mean of this age is more important than you compare the tables command by the age group. Suppose gender versus age group, instead of that, mean age versus gender will be much better. So that whenever possible, we can do that. Similarly, here is the BMI category is there. So we have direct and also BMI is better than BMI category. So we have a lot of things to compare. I don't know about the objective of this study, but it looks something like diabetes, BMI, etc. So let us save this file as XLS file rather than the latest file, so that we can do the analysis. See, we are saving in XLS format. We are saving it. Now we open up AP info over here. Launch AP info. We open the classic. Then we read the file. And we are choosing XLS file. And now browsing the file where it is our file. First is a header, and then diabetes analysis. The first data sheet we are going to use for analysis. And it says rate record count 999. So let me see, go and see whether the count is the same or not. Two 51 and source 99. There seems to be others records, blank records. So it is better that let's copy another sheet. Final. We need to go. This practically you will be able to understand that we close this file because it shows 99 record. If you look at the frequency of gender, or let's say frequency of age group, let us see, is 250. And the record shown over here is 999 because the blank record are also seen. If you add frequency upon age group, you can see that here 749 missing records are there. So it is reading Excel file, but in the blank scene are there. How we can know this? Just by using the set command. So we can in set we say that we don't want to include missing, and missing is known as missing. Missing values are also sometimes important. So again we do the frequency command. So first you need to have a control over the file. This is the first step. Read the file, take a control. You know that there are 250 records. Now, first thing which we would like to know about, is there any means of age versus, we say, the BMI category. You can see that the BMI category 1, 2, and 3. Right? The age is 55, 56, and 56. So almost group 1 and 2, there is no significant difference in the age. Right? Then you want to use a simple table command. For example, the BMI category versus age category. Age group. This is how you can compare. And you can see the p-value. There is no significant difference between age and BMI. You can see that. You can have other command tables. Now in this exposure variable, let's say duration diabetes category, BMI category, medications. So you can have exposure gender wise, you can say that is there any difference the duration of diabetes. So duration of diabetes is a probably continuous variable. So we should not use the table command, we should go for means. Right? Means of duration of diabetes versus gender. So in male and female, is there any difference in mean duration? So here 1 and 2, the meaning should have been written rather than, so if you go for frequency of gender, you should write male and female rather than 1 and 2. So here it is 1 and 2, but meaning is not. So if you have written directly, that would be better, right? So you can say that the mean duration is significantly different between group 1 and 2. Doctor, do you know what is 1 and what is 2? Can you tell me that? 1 is female or 2 is female? Can you tell me that? Then we can have a better interpretation. Then there's a linear regression between, there's a duration of diabetes, and if you look at the age, right, and you can see the linear regression. You can say R is 0.54, right? Correlation coefficient. That is, seems to be some correlation between age and the duration. So this is how we can do the data analysis. And again, you can have means of the blood sugar versus you can have BMI category. So mean blood sugar is higher in category 3 and then 1 and 2. This is a clearly seen. And this is higher, but if you look at the p value, it is not significant, right? So this is how we can do the analysis. Any other question? So I hope if you understand your file properly, you will be able to use the commands tables, means, and frequency. So any question? So have you thought of any topic for the purpose of doing the research in which you will be selecting your sample size, sampling method, you are defining the questions, you make a group of 4 or 5 people. Is it possible? Dr. Sonali might have a group of MPA students and together. I think you should aim of doing some research study across the India. All the MPA students of India should join in that.
Okay, sir.
So think of that.
So,
Yeah.
sir, actually, I'm interested in cancer research, sir. Onco research.
Yes.
Sir, I will be needing some guidance from you that actually right now I am posted as a intern, project intern in DGHS Indore zone in a UPHC. So there is a monthly and quarterly reports of NCDs and many diseases. So, sir, how should I start? Like question from Google Form questionnaire, should I start from the patients, or I will have to intervene in the communities to have a zone wise or area wise interpretation or data collection? Like, how should I start, sir?
So, as far as your imagination concerned, you should be able to imagine the best and ideal. And
Okay,
when it
sir.
comes to a practical, then you should be able to go for the feasible. So the ideal is that think of that you are covering all 800 crores of population of the world, right?
Okay.
And you are following them for 100 years. Just this is the most side, right? Each and
Yes.
every one you are covering. This is what is ideal. Then you will be able to understand why the cancer is there, why other cancer not. But because whole world is not possible, let's come back to the India. Now, when we come back to the India, you have control of the indoor data, something like that. But other cities, other interns will be there, other students, other doctors, interested people will be there. So
Yes, sir.
first and foremost thing, what you should be doing to make a group of people who are interested in cancer research, right?
Okay, sir.
So let us presume that at least 10 or 20 individuals are ready in different cities, different rural area, etc., like you, who are ready to do the research on the cancer.
Yes,
Now,
sir.
we know that cancer is not a phenomenon will come in like influenza within 1 or 2 days. It takes years together to come out. So you can have a focal focus of cancers in the Punjab, in Gujarat, at various places also. So
Yes, sir.
now you start with a case control study, of course, as people are starting because the is a disease where you'll have to wait otherwise long for the core study. So what can be done that you go for the let's say initially 10, 20 cases and control,
Yes, sir.
but then with your friends 20, 30, 40, all of you can take, let's say 50 cases and 50 control, then probably it will be much better. And because you can have a more controls, you can take a 5 controls versus one cancer case, and then the in cancer case also you can do take a mild, moderate, severe. You can also take a precancerous condition so
Yes,
that
sir.
it gives you better. So you can have a precancerous condition, your no cancer condition, and the cancer condition. You can have three things together. And then if you do the retrospective study in case control study and certainly find your 10 or 20 or 30 the lifestyle problems or the tobacco, etc., which can be carcinogenic. In, for
Yes,
example, cervical cancer, there could be other factors. So you
yes, sir.
define which cancers you would like to take, right? And
Yes, sir.
start from the easier thing, which is easier to find out. And
Yes, sir.
then you can go later on at a later life for the difficult cancer also. Because when we talk about the cancer, cancer is just like a word disease. I want to
Yes.
do the study the disease. It's not the cancer. You specify which cancer you would like to study, and then you
Yes.
start case control study. Core study will be extremely difficult, but because you are young at this age, think that after 1 or 2 years, you will be selecting a cohort in a particular area. For example, cervical cancer, you may take a group of prostitutes and group of the housewives, right? And the other group, something like that, no? The nurses like that. So, and then you follow them up for 5 years, 10 years. What about cervical cancer? Those who are vaccinated for cervical cancer, not vaccinated, that can also be a very good group to compare over a period of time, right?
Yes, sir.
So I think that will be much better. And as far as randomized control style is concerned in cancer, it's extremely difficult because see, it will take few years. You are changing lifestyle in one group, and when you say the one group, you may to take 10 talukas or 5 talukas where you talk exclusively about the lifestyle. Other 5 talukas take the control, and then over a period of 5 years, 10 years, you follow them up, whether there is
Yes.
any improvement in lifestyle or not. But whenever we are giving us our input, we should see the need of the society, our need, our interest, and
Yes.
if possible, we should be doing something which is a definite outcome, and large people are going to benefit out of that. That will be better. And naturally, you can start with making a group of people. You just make a first a WhatsApp group
Yes,
and
sir.
say those who would like to join in the cancer research study, please join this group. You will get at least minimum 100 people from all over India. Out of that, you make a series of meetings and you will get 10 or 15 committed people. And then
Yes.
you start making a Google form and you'll have a
Yes.
great day ahead.
Yes, sir.
Any other question?
Thank you, sir.
Yeah. Okay. Are you using the nutrition software which I had said?
So, no, sir. Sir, right now, nutrition software, no, sir. I have not
Uh,
registered on that, sir.
you so request tomorrow if you like that, please say again, then I will share the software. And then on the same day you have to do registration, otherwise it will not work, and it will work for 1 year. So you can share with your colleagues also, and it's
Yes.
very interesting, right? And
Yes,
for
sir.
prevention of cancer, vitamin A is important, vitamin C is important, vitamin E is important, and the comparatively the preservatives, the run, the colors and essence, and the all sweeteners, etc. They are likely to do more cancer. So
Yes, sir.
you will find this, right? Okay, thank you.
Yes, sir. Thank you, sir.